This week, President Obama gave a speech about health care. Or actually, I guess it was last week now. The speech was at a fancy hotel here in Washington, and he told jokes to make everyone laugh and sad stories to endear his audience further to his cause. The president said, as he has many times before, his law will lower the cost of health care. President Obama knows how to give a good speech, and he also knows how to tell it like it isn't. While President Obama was busy selling his policies on the stump, others were busy analyzing the real effects of his health care law. It's not limiting cost. Now, we heard some of the figures given by the Democrats here from the Congressional Budget Office, but we have to expose that they're really playing with numbers. If you tell the Congressional Budget Office to take $500 billion from Medicare that's already bankrupt and can't pay doctors to see patients, but you take $500 billion and call that savings that are created by Obamacare, that's part of where they get their money. The other part is to raise taxes on a lot of health care products and services and call that new revenue created by Obamacare. Any thinking American knows that you can't create a $1 trillion new health care entitlement and it actually saves us money. When the Congressional Budget Office looks at our whole health care spending at the federal level, it tells us, without all these funny assumptions, that the federal spending on health care is going to double over the next 10 years. That's not saving us money. And this is the same office that found, without these funny assumptions, that Obamacare would cause premiums to rise an average of $2,100 per year for families in the individual market. That's telling it like it is. It wasn't that long ago that some of the country's largest insurance carriers sent a letter to their enrollees warning them that Obamacare was going to drive up the cost of premiums. They told it like it is. The Obama administration didn't want this information to get out. So the Department of Health and Human Services sent a letter back to the insurance carriers saying their claims were not true, and HHS would have zero tolerance for this type of misinformation. They want to keep on telling it like it isn't. Richard Foster, the chief actuary for Medicare and independent economic expert, recently testified before the House Budget Committee. He was asked if it was true or false that Obama's health care bill would lower cost. Just a true or false question. He said, "I would say false more than true." He told it like it is. False more than true is a very polite way of saying no, it won't lower health care costs. That claim is false. President Obama also promised that if you would like to keep your health care plan, you can keep it. Richard Foster was also asked if those who like their health care plans would be able to keep their coverage. He said, "Not true in all cases." It certainly isn't true if you live in one of the 34 states where health insurers stopped selling child-only policies. And it's not true if you live in Colorado and have Aetna insurance. Politico reported Monday evening that the health insurance carrier was pulling out of the individual markets. And many Americans will lose their health plans with Obamacare. But you can keep your health care plan if your union or company got one of the 733 Obamacare waivers so far. The waivers cover almost 2.2 million people. You can get your health care, or you can keep it, if you're a member of the 6 chapters of the Service Employees International Union who got waivers and whose political action committee spent more than $27 million helping Barack Obama get elected. Or if you're one of the 8,000 members of the United Food and Commercial Workers Union that got waivers, their PAC has spent millions helping Barack Obama and Democrats get elected. These are the unions that supported cramming Obamacare down the throat of the rest of Americans. Even though labor unions represent less than 7% of the private workforce, they have received 40% of the waivers. They don't want the health care they want other Americans to have to accept. Most Americans don't play these political games. They don't have lobbyists and PACs, but I think they should all get a waiver too. I think we should name this repeal bill that we will vote on today the Great American Waiver. Every Republican in the Senate is committed to repealing this bill. Every American gets a waiver when we repeal this bill. Soon we will have a vote to repeal ObamaCare here in the Senate. I strongly urge my colleagues to follow the House in repealing it and returning it to the sender in the White House. I'm aware the President currently in the White House might want to veto our repeal. There is, however, going to be a presidential election in 2012, and this health care bill, this health care law, is going to be a defining issue in that election. 2012 is 2 years before the law will fully be implemented. We can get a supermajority to overturn his veto in the next election, or we can get a new president who will support its repeal. I think both outcomes are possible. Let us all go on record now showing where we stand. I suspect there are some Democrats who might want to repeal this law before voters repeal them. The question is, do they have the courage to break with their party? For now, the President would like us to think his law can be fixed by modifying it slightly. It can't be fixed. Trying to fix it with a few good ideas is like pouring a few glasses of fresh water into a polluted river. Obamacare cannot be fixed by tinkering with its provisions because the basic premise is flawed. This law is actively creating a government control system that relies on high taxes, less choices, and bureaucrats making health care decisions for Americans. This is exactly what we are opposed to and why we insist on a full repeal. A recent analysis by the Center for Health Transformation found it will give the Secretary of Health and Human Services 1,968 new powers. Last year, the Joint Economic Committee found that Obamacare created 159 new federal programs and bureaucracies to make decisions that should be made between patients and their doctors. If the Democrats and federal bureaucrats are permitted to control our health care system, our tax code will look simple by comparison. Worst of all, in the rush to pass this legislation, none of its proponents cared if it was unconstitutional or not. They weren't going to let the Constitution get in the way of their health care takeover. Even now, when asked about the constitutionality of the bill, Secretary of Health and Human Services has said, "I'm leaving those arguments to our legal team from the Department of Justice." So far, their legal team is losing. Two judges have told it like it is. Obamacare has been ruled unconstitutional by judges in Virginia and Florida. The Virginia court held that the individual mandate requiring every American to purchase government-approved health insurance was unconstitutional. The Florida court ruled the entire bill was unconstitutional because of the individual mandate included in it. In his decision handed down on Monday, Florida's district judge, Roger Vinson, compared the law to a finely crafted watch in which one of the pieces is defective and must be removed. But what happens to Obamacare when you remove that one piece, which is clearly unconstitutional? The rest of the law falls to pieces. As the judge might say, the watch won't work. Vinson wrote, "I must conclude that the individual mandate and the remaining provisions are all inextricably bound together in purpose and must stand or fall as a single unit. An unconstitutional law that touches the most important personal decisions Americans ever make must not stand. We must repeal the bill in its entirety, because at the very heart of it, which makes all the other parts work, that very heart, that individual mandate, violates the highest law of our land. And it's already failing Americans. Healthcare costs and premiums are going up, despite the false assumptions we hear on the other side. Choices in consumer control over the healthcare system are going down. By continuing to follow a failing plan, the government is planning to allow our healthcare system to fail. Obama's broken promises are going to create a broken future for our country. If we do not fully repeal this bill, it's going to add nearly $500 billion in new health care taxes and raise the federal budget deficit by more than $500 billion in the next 10 years and nearly $1.5 trillion in the next decade. Yet the President says that this is going to save us money. We know this so-called Affordable Health Care Act for America does not live up to its label. We must repeal this bill and implement common-sense solutions that will lower the cost of health care for consumers and make health insurance available to everyone, even with pre-existing conditions. We should allow Americans to choose affordable plans across state lines, and we should end frivolous lawsuits that drive up costs and give equitable tax treatment to those who don't get insurance from their employer. Obamacare does none of this. The facts and figures tell it like it is. President Obama tells it like it isn't. It's time for Congress to tell it like it is and repeal Obamacare. Thank you, Mr. President.